Hi, my name is Kimberly Brant, and I am doing a project on dietitian and free fruit and vegetable stand for UVM Adult Primary Care. I've been working there for 3 years, and I saw this in another facility, and I thought it would be a good idea. Um, so, um, Hold on. I am having issues with my thingy here. So there is a few things that I'd like to go over. Um, One is the need for the project. There's a lack of dietary guidance with patients with heart failure. Um, so really a lot of the patients that have congestive heart failure, um, they have like no knowledge of what they're supposed to be eating, and they're not supposed to have like a high sodium intake, and they really need to watch their sodium intake. There's also a lack of knowledge with patients with diabetes. These patients, they tend to get like wounds on their feet, or really diabetes and heart failure and hypertension and hyperlipidemia. They all really come together. A lot of people will have all of these diagnoses at the same time. So it's really important that they do have the knowledge of their diet, what they should and should not be eating. And then another concern is patient financial concerns for proper nutrition. Um, there's a lot of people out there that really don't have the financial needs. They don't make enough money to get the healthy food that they need for their diagnoses. And then we're going to go over the project overview, services, materials needed, personnel needed, and the budget. So this is a picture that I found, and it has like the what a healthy diet versus an unhealthy diet could do. The unhealthy has like the obesity and cancer and diabetes, a lot of those types of things going on there. Depression, when like the healthy figure here, it's love, fitness, diet, sports, energy. Really, when people say you are what you eat, it's really true. So the need for this project, like I said, there is a lack of dietary guidance with patients with heart failure. Poor diets in patients with heart failure may contribute to obesity and lack of nutrients. The focus on these patients that have heart failure is sodium and fluid intake restriction. But these patients need guidance on what nutrients are important to take along with these restrictions. According to the Journal of Cardiac Failure, Nutrition, Obesity, and Cachexia, is in patients with heart failure. Patients with heart failure should be offered at least one session from a registered dietitian or other health professional with specialists that specializes in nutrition knowledge for nutritional evaluation and education. And then we have the lack of nutritional knowledge effects on patients with diabetes. Dietary education to patients may promote dietary self-management of diabetes. And according to the British Journal of Nutrition, supporting patients to understand the contribution of all nutrients to the energy content of food and the value of using this information on food labels and to place energy balance in context in practical ways is a fundamental message and skill that requires greater emphasis during type 2 diabetes education. So it's really important that they do get the proper education that is needed. And what better way of doing this than having a dietitian that is there at the facility, giving them all the knowledge that they may need. Then we have the patient financial concerns for proper nutrition. Many Vermonters live in a household that have food insecurities with the increase of costs of groceries and lack of affordable housing and low wages. Many patients count on food shelves or 3 Squares Vermont to provide food for their families. And, a lot of those food shelves, they don't have, really healthy food there. I mean, they have food, but not anything that is good nutritionally. For the most part, I know I had a patient and he's like, oh, he has diabetes, and he said, I can't afford anything. So I go to the food shelf and I just get hot dogs and, those fake powdered mashed potatoes. And, being a diabetic, it's not very good. It's not good for him nutritionally. So he had a lot of problems with his diabetes, and I believe it had all to do with what his food intake was. According to the 3 Squares Vermont website, 59,882 people in Vermont live in a food insecure household. It's really sad, but it's true. So I posted a picture on my slides, and it is of a fruit and vegetable stand. This is an example of what it could look like. And, it doesn't have to be like this big or, it's just, I think that it's really important that a lot of our patients, especially the elderly that are more prone to having these diseases, get the proper nutrition that they need. Let's see here. Then the description. So physicians would refer the patients that need the education regarding a healthy diet due to their diagnosis. The physicians would refer these patients to the dietitian at the facility, and then they would also place an order for whatever diets that these patients would need based on their individual diagnoses. Then a fruit and vegetable stand filled with fruit and vegetables provided from local farmers. This is, like I said, this is an idea that I've seen from another adult primary care, and I think that it is such a great idea. especially if you've been a person that, doesn't necessarily have much and struggles for food. And then the dietitian would also have handouts, and it would have really important information and have diagrams to help these patients understand their needs. Then we have the services. It improves the quality of patients' health by providing the patients with the knowledge of what they are or what they need to concentrate on in their diets. Every diet does have a different need with the diagnoses. So, if somebody has heart failure, their diet's going to be different than somebody that has diabetes. And then this will also motivate patients about their health and diets. Just having that support system here at our adult primary care at UVM, I think that would be really great to see that. And then encourages follow-up with their healthcare providers, with patients, and a lot of patients, I don't know if it's lack of insurance or just, they're too busy working, they can't take off from work or something. But a lot of them haven't even been to the doctor in like 20 years. Until something significant comes up in their health and they're like, hey, I really need to get this checked out. I think that having a healthcare provider, seeing them at least every 2 years would be a great benefit for these people that are more prone to having diabetes, obesity, heart failure, and hypertension, and hyperlipidemia. And then the materials needed is the fruit and vegetable stand and informational handouts and office supplies. So the personnel, the exucation. Okay, so the project requires a dietitian, of course, and then the existing office manager, healthcare providers, nurses, clinical care associates, and office staff. So really the only new person there would be the dietitian. So the new dietitian's responsibilities include conducting informational meetings with the patients, ensuring that the fruit and vegetable stand is stocked with fresh fruits and vegetables, finding farms or stores to donate the fruit and vegetables, and then working together with the health care providers and office manager, really all staff. So all the patients are aware of what we can offer them. For the budget, I am thinking that the budget's going to be like $70,000. The dietitian, I looked that up, and it was for their salary a year would be $56,000. That's average. And then the handouts, paper, office supplies, that would be $12,000. And the stand for the fruit and vegetables, I put $2,000. Really, this is all, I guess. I tried to look everything up as much as I could, but really, I don't know what dietitians start out as. So the conclusion is implementing a dietitian and free fruit and vegetable stand in an adult primary care clinic. It can be a hard task to complete. It will require supportive staff and a collaborative team effort. We are eager to work on this project, and our goal is to ensure you, our staff, and our patients with a smooth transition. I provided the references that I made in this project. And if there's any questions, please feel free to email me.